Good morning, members of the board. I'm Dr. Stockton, the Health Officer for Humboldt County, and with me today are
Sophia Pereira, Public Health Director.
Good morning. I'm Laura Weiss, Deputy Branch Director for Public Health.
Thank you for the chance today to talk with you about the Community Health Improvement Plan, or CHIP, and Live Well Humboldt. Today we're going to be sharing a little bit about the process used to develop the plan, the public health frameworks used to guide that process. We'll share some highlights from the document, and we'll also be sharing the next steps of how you and others can be involved. And the outline for today's presentation roughly follows the hard copy handout that you were given. Next slide. So first, a little bit of background on the CHA, the Community Health Assessment, the CHIP, and Live Well Humboldt. Our most recent Community Health Assessment was published in 2018 and was the result of efforts by the community and the Community Strategies team, a collaborative team of community partners. It uses information from a variety of sources to create a snapshot of the status of health in Humboldt County. It includes data around the leading causes of death and illness and the root causes that contribute to these health problems. It also looks at which community members experience health inequities, embedded differences in access to the opportunities for health. The team met monthly for over a year, focusing on data and how to inspire the community towards collective action. In the fall of 2022, we issued an update, or a CHA enhancement, which included new data from the Oral Health Project, as well as Allies for Substance Use Prevention Coalition. We're proud to introduce the new CHIP, which was informed by the data in the CHA and sets out goals and strategies for the next 5 years. You can find all these documents on the public health data page of the DHHS website. Last, Live Well Humboldt is the community collaborative network that guides this process of assessment, planning, and action toward health improvement, while we at Public Health have had the honor of ushering the documents through this process. Live Well Humboldt has assembled and reviewed the data, set goals and strategies, and is doing the work that begins to address the needs that have been identified in this process.
While there was an interruption in our work on the CHIP during the pandemic, we are so grateful for the robust partner engagement we've had in the past year or so. The Live Well Humboldt Data Work Group held 5 meetings over the past year, facilitated by our CHA and CHIP program coordinator, Ashley Gephardt. This represents many hours of participation of approximately 140 community partners. Together, we worked on each priority area to help summarize the existing work that is happening to improve community health, to identify measurable health outcomes that we agree to use to monitor our progress, and to integrate health equity into our work for improved health for all. Really just want to give a huge thank you to all who participated in this work, including some of our partners that are here in the board chambers today.
As we think about our plan for improving health in our community, we consider what we're doing to improve the underlying conditions, or the social determinants of health, and what we're doing to build resiliency early in life. These root causes include factors such as education, economic stability, built environment, racism, and discrimination. Whether or not a population benefits from positive health determinants is often tied to historic and current policies that are rooted in systemic racism and other forms of oppression, creating health inequities. Pages 11 through 13 of the CHIP review specific data describing the social determinants of health in Humboldt County. The importance of the social determinants of health reinforces the need to work collaboratively with multi-sector partners to address these complex issues, including with you as the policymakers of our county. In fact, the Humboldt County Strategic Framework addresses many of these social determinants of health and resiliency factors through the strategic plan focus areas: healthy and safe communities, a healthy environment with robust infrastructure, a resilient and thriving economy, and improving county government operations. Another consideration is health equity. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. Unfortunately, our community health data shows that this is not the case. In order to move the dial on health outcomes in our community, we need to understand the root causes of those differences. The cause of these disparities for Indigenous communities, for example, is understood to be rooted in the historical experience of colonization, intergenerational trauma, and ongoing inequities due to the persistence of structural racism in policies and practices throughout society and systems. It is also acknowledged that tribal people are diverse and have demonstrated powerful resiliency and unique community assets that promote health and wellness. Input from tribal members and diverse community partners is essential to focus on honest and accurate descriptions of the inequities, together with an understanding of community assets, to help steer us towards effective policies and solutions for health improvement. While the graphic on this slide may make it seem simple, understand the diverse needs, and design equitable strategies, how to do this effectively is in actuality a challenge. We are encouraged that advancing health equity and racial equity is a focus of many local organizations and collaborative community efforts, and we value the opportunity to learn and work together in order to meet this challenge.
The priority areas in the 2022 CHIP are behavioral health with a focus on suicide and substance use, housing instability and homelessness, and healthy beginnings and adverse childhood experiences, ACEs. They were selected through a series of community engagement processes in 2019, including Humboldt County's Budget Roadshow, Providence St. Joseph's Hospital Community Health Needs Assessment, community focus groups, and several town hall events. And you can see more about that engagement process on page 20 of the CHIP. As a result, these areas of focus are aligned with several other plans, including the county's strategic framework and the Providence St. Joseph Hospital's CHNA, for example. These selections should not be surprising to anyone, as the CHA data clearly describes the gravity of these challenges in our community. Additional updated data can also be found in the CHIP. There are many collaborative groups already working to improve outcomes in these areas. The CHIP process will help coordinate the activities in each priority area and identify relevant, measurable health outcomes that community partners will use to track progress towards equity and improved health for all in Humboldt County. Pages 24 to 58 of the CHIP provide information about collective action for each of these areas. This section includes a strategy map for each area with agreed upon goals, strategies, and measures for tracking progress. It is impressive how much is already happening in each of these areas. For the next slides, we will briefly highlight some examples of how our community is putting the goals and strategies into action.
While suicide is a significant public health issue in our county, there is hope. The evidence for effective suicide prevention strategies is growing daily, and this CHIP represents the local action being taken to support all community members and to save lives. See pages 23 through 30 for this section. The Humboldt County Suicide Prevention Network and the Yurok Tribal Wellness Coalition's Suicide Prevention Task Force are two examples of partnerships that are providing impressive community leadership for suicide prevention in Humboldt County. For this priority, there are 4 goals overall and many strategies and activities. Again, it is impossible to share all of the amazing work that is happening here, but as an example, Goal 2 is to minimize the risk for suicidal behavior by promoting safe environments, resiliency, and connectedness. Examples of supporting strategies include collaboration with firearm retailers, safety instructors, and gun range owners to reduce access to lethal means, educating retailers on suicide prevention strategies and how to recognize risk for suicide, and the Keep It Safe program, a campaign to encourage use of lock boxes and cable gun locks.
The second priority area in behavioral health is substance use disorder. You can find the background, measurements, and strategy maps for this area on pages 32 through 39. Some examples of the many networks that are providing community leadership in this work are Allies for Substance Use Prevention, UIHS Opioid Awareness Coalition, RX Safe Humboldt, the Yurok Tribe Wellness Coalition, Humboldt Harm Reduction Coalition, the Humboldt Community Health Trust. These multi-sector coalitions have focused on various strategies. These include developing and disseminating safe opioid prescribing practices, hosting youth engagement and substance use prevention activities, promoting policy development, raising awareness about local substance use disorder resources and services, and increasing access to treatment, advancing harm reduction, reducing stigma for individuals living with SUDs, and hosting trainings on and distributing naloxone. Again, to highlight just one area in Goal 3 is to reduce harm associated with substance use. Reducing the harmful effects of a disease to improve quality of life and decrease disease complications is the cornerstone of all chronic disease management. An example of this are the many organizations in our community that are working to increase naloxone trainings and distributions. While we have more than 70 confirmed overdose deaths in Humboldt County during 2022, we have 374 reported community reversals with Narcan naloxone distributed through these efforts as of April through December of last year, when RxSafe Humboldt began collecting that data.
Housing instability and homelessness. This area of focus is outlined on pages 41 to 48. Housing is an important determinant of health, as we discussed earlier. No one agency could do this complex work alone, and there are many dedicated partners involved in so many aspects of it. One of the goals Live Humboldt identified for this priority area was goal number 2, increasing access to supportive services for people who experience or are at risk of experiencing homelessness. As you are likely aware, there are many examples of creative and exciting initiatives supporting this goal. For example, your board supported Arcata House Partnership's new units to house up to 54 people experiencing homelessness at the Grove in Arcata, a project that includes case management and connection to specialized services. Another example, the Housing and Homelessness Incentive Program, a Medi-Cal program, is coming through Partnership Health Plan and will fund a year of program support money to reduce and prevent homelessness among Medi-Cal recipients in partnership with existing organizations. That funding can support street outreach services, housing transition, navigation, housing deposits, et cetera.
The final priority is healthy beginnings and ACEs. This section of the CHIP is found on pages 49 through 58. It is now widely understood that a person's experiences early in life strongly contribute to all of the health issues we have just discussed and more. This knowledge presents an opportunity to focus on prevention by ensuring that children get a healthy start and promoting resilience to mitigate the risks and impacts of ACEs. As you know, First 5 Humboldt has been an incredible leader in this area. There is more information on their website, as well as in the CHIP, about scientifically supported approaches to this work. Goal number 1 for this priority area is to promote a healthy start and ongoing protective factors for children and families. Strategies supporting this goal include the work of so many wonderful programs noted on this slide, and many more discussed in the plan. Together, they aim to coordinate culturally congruent services for children and families through different stages of development. Examples include employing healthcare navigators as part of prenatal care and birth, parenting classes, evidence-based home visiting programs, and the many other supportive services provided through our network of fabulous family and community resource centers.
While the resources and efforts contributing to health improvement for our community are impressive, the challenges are enormous and complex. Live Humboldt is a collective impact initiative that provides backbone support to improve how we work together. This includes supporting the conditions of collective impact identified on page 10 in your document. The next steps will focus on making local health data more accessible. This means easy to get to and understand for our community and to track progress on health outcomes. Ensuring that health equity is a focus in prioritizing data and in telling the story behind the numbers, and strengthening the alignment of work across and within our sectors. We're excited to share that we are currently in contract negotiation with a vendor to help create a community health dashboard. This slide shows some examples of dashboards used in other counties. The dashboard will include community-facing accessible data that is updated regularly, annual reporting, and showcasing of successes and challenges in our community. We look forward to working with our Live Humboldt partners on this project and to building a leadership and communication structure for Live Humboldt. We're currently developing the Live Humboldt Charter, identifying and recruiting leadership team members, forging a work group structure that operates through existing coalitions like the Suicide Prevention Network and Allies for Substance Use Prevention, and includes community partners.
So in conclusion, thank you so much for taking the time to learn about the Community Health Improvement Plan and our process, and just want to thank all of our partners who helped to develop this plan and to do the work every day to improve health for all in Humboldt County. Thank you.